Hello, this is Dr. Daniel Lonquist. You are about to listen to an interview I did as a guest speaker on the popular internet radio show Health News, which airs weekly out of the Northeast United States. The interview will give you a general overview of the value of a health and wellness program that is customized for you. What it will not do is allow me to answer your questions about your health goals and what issues you are currently having that I can help you with. After working with hundreds of people over many, many years, I know nothing is more important than helping you. I know you want to be healthier next year than you are this year, and even healthier 5 years from now. I also know finding the answers for the problems you have right now are the most important, and I want to help you, or at least point you in the right direction. The best way to do that for me is to offer you a complimentary consultation with me over the phone or in my office. There's no obligation and it won't cost you a thing. Just a one-on-one geared towards making you a healthier you. Now write down my number, 970-257-9199. Give me a call and let's find out how to make every day a healthier day for you.
Well, hello, it's Dr. Alan Weinstein here at the Weekly Health News Show, and today we have a very special guest, Dr. Daniel Lonquist. Good morning, Dr. Daniel. How are you?
Good morning, Dr. Alan. I'm great. How are you?
Well, we're doing great, and we're really so excited that you're here today. And I wonder if you don't mind, take a minute and just tell the audience a little bit about you, sort of an introduction. And what I decided to do was, I pulled this off your website, if you don't mind, and I'm going to quote this because I really think this is really well said, and I really think it'll give the audience a good look into where you're coming from. I think it's going to be a great place to start the interview. So let me take a minute and do that, and then we'll jump right into it, okay?
Okay.
Okay. So I'm quoting here from Dr. Lonquist's website, and let me go right into it. Simply put, I was a skeptic. I grew up thinking medications were the only way to treat aches and pains. My friends and family were unfamiliar with natural solutions to health problems. I didn't experience a miracle, but I've seen them. I just wish I had known then what I know now. And I think really, Dr. Lonquist, that really speaks volumes. And so I think I'm going to start today for our audience is really to ask you, how'd you get started in the business?
Well, I've always wanted to be in the health profession, and I always knew I wanted to make a difference in people's lives. And when I was in university, I found out about chiropractic care, and the more I looked into it, the more I realized how I could help people through natural means without medications or surgery. And I just knew then that that's what I wanted to do for my life. So for the past 20 years, I've been constantly learning about health and wellness, and my approach to treating health and improving one's health and wellness has just been constantly evolving.
And I know, Dr. Lonquist, from speaking, of course, in the past, that you've taken hundreds of hours of postgraduate education, radiology, spinal biomechanics, nutrition, exercise, physiology, and you're really, really involved. And so you really must love what you do. So what do you love most about what you do?
The biggest thing is I love that I can improve the health and well-being and quality of life of my patients and people in my community, my friends, family, everyone I'm around. And I like to change people's belief systems on health and wellness from a disease care model in which we just try and manage disease or symptoms to a true wellness care model in which we can provide the body with what it needs and also to remove what is harmful. And just seeing people's lives change through what I do just reinforces my passion for chiropractic and for just treating people.
So I know you've been doing this a long time, and what kind of problems do people come to you for that you solve for them?
Well, a few different things. Some people don't know exactly what I do, so they typically come to see me with a particular condition, ache or pain or disease process. However, I try and change those people's belief systems, and I educate them on the faulty paradigm that disease is caused by either bad luck, bad germs, or bad genes. And the majority of the population believes that health is largely predetermined by your genes, and they believe that we have no control whether we get disease or not. So I get people to realize that it's normal to be healthy, and that it's our lifestyle choices that create disease and also that can promote wellness. And I educate people on eating, moving, thinking, since all three of these factors are necessary to live your life to its full potential.
Dr. Lonquist, I really like that, the way you said that. Tell the audience the three bads again.
Well, it's bad luck, bad germs, or bad genes. For instance, people are always saying, oh, I caught the cold because Mary or John had it. They don't realize that the only reason they caught the cold is because their immune system wasn't able to fight off the germ. So they blame situations rather than blaming their own lifestyle habits.
Very well said. That was really great. I really like that. So, why would someone, or why should someone seek solutions from you?
Well, people come to me for a few different reasons. One is to improve their health and well-being. If they have symptoms, they want to get out of the symptoms. Some people can come to see me just to promote health and wellness if they've been educated on the positive benefits of being proactive, but also just to provide an education and motivation on how to live a healthy lifestyle. So one thing we've incorporated into our office is one-on-one wellness coaching that's in addition to their care here. That includes stress management, weight loss, exercise, eating right, quitting smoking, various different wellness topics.
So you really are the complete program. I mean, you really take it all. You really bring all of it into the picture. So they can come in for treatment, but really the one-on-one really gives them the ability to really reach what I guess I would use the term, and tell me if you agree, their real full potential health-wise.
Yes, and that's what I've incorporated in the practice, and just through all the learning I've done, I've realized that those factors are necessary if someone wants to reach optimum health. So that's why I've incorporated them in, and I'm constantly improving those services and providing what the patient needs.
Great stuff. So with all the services that you provide, how can someone tell if they'd actually benefit from all the things that you do?
Well, first of all, because of the prevalence of bad lifestyle choices in our industrialized society, most people can benefit to some extent from what I do. But to get to know how much exactly they may or may not benefit, we first run some people on some sophisticated nervous system scanning equipment that's actually certified by the Space Foundation. This equipment can tell how well your nervous system is actually functioning and how well it's adapting to the different stresses in your life. So rather than waiting until someone has symptoms and treating those symptoms, we can get an inside look at the functioning of someone's nervous system. And as you know, the nervous system controls every cell, tissue, and organ in the body. So it's very important, if you want to lead an optimal lifestyle, that your nervous system has to be functioning properly.
So you really bring in the high-tech stuff really here to really be able to get to the underlying cause. And I'm going to take this in a different direction. I want to talk about health and some other things, but do me a favor, before we go in that direction, just tell everyone how they get in touch with you, your contact information, so they have that before we forget it.
Well, they can reach me at my office.